All right, so Dr. Jankowski and I are coordinators of the program. And we'll go into what it is. Okay, so these are some things that people have worked on. Students like you have worked on this with mentors. Childhood obesity, discovering ways to help cancer patients sleep better, massage for infants with reflux, determine the impact of trauma and abuse and opioid use disorder. So there's a variety of things that you can study in the honors program. Now, Dr. Pat Grady is not the director anymore, but when she was, she said there of the NIH, the National Institute of Nursing Research. There is a real shortage of nurse researchers and faculty. So we need more nurse researchers. And it doesn't mean, I think people don't know what nurses can do in research. Nurses can do anything in research. Nurses can do bench research. Nurses can do any kind of clinical research. They can do preventative research. So it's not like just studying nurses. That's not what nursing research is. So there are many, many areas that nurses can do, many topics. And so what we want to do here is to take some exceptional nursing students and try to encourage you to choose a research career. So that would mean a PhD. And when you're in, we'll talk about this more later, when you're in the clinical area, you're going to get a lot of talking about DNP. That's a clinical degree. And what you would be doing then is kind of different than research. You'd be doing more evidence-based practice and quality improvement. So it's a little bit different, and we'll get into that more later. In fact, right now. So this is research, and research means that you are generating new knowledge in physical, biological, and social sciences. So you are, as a researcher, finding new things out. You're not testing things that somebody else found out already. Whereas if you're a DNP, Doctor of Nursing Practice, it's clinical. So you're applying knowledge that's already been discovered in the clinical setting and seeing how it works in the clinical settings. Both are good, but they are different. So people who want to, find out new things are generally going to go toward the PhD. Now, with our honors program, if you complete the honors program, you get preferential consideration for the PhD program, not the DNP program, the PhD program. Anybody have questions? Okay. Okay, so what is it? What do we do? It's, you conduct your own research. And it's not like you have to have the be all and end all of research. You do a small research project when you're in here, and it's based on your mentor's research. So you can, we've had students that maybe will take data that the mentor already has. So the mentor's collected some research, some data, and you and the mentor talk about what kind of question that you might want to explore using that data that's already there. So you would do a literature search and really write like a real research paper, literature search methods that you did. And you look at the data that the researcher has, that your mentor has, and you come up with something, but it's yours. And when you present that research at a conference, or if you write an article, you would be first author on that because it's yours. And a lot of people come in when we interview and they say, well, they think this program is maybe you follow a researcher around in the hospital and you just follow that person and then you write a paper on what you learned. But that's not what this is. This is much really more, it's a higher quality experience. Another person came and said, well, when I was in an honors program in my other school, we went to Italy and looked at a lot of museums and hospitals. Well, that's not what we do either. No trip to Italy. And then the other thing that people think is that they're going to get a clinical experience here. So we had somebody else say, well, I want to learn more about OB. Well, that's not what this is. This is to, that you learn about research. So what we want is to promote your scholarship and your intellectual and professional development. You will write a thesis paper that can be publishable. And you can do that, that's sort of optional. Well, your thesis paper is not optional, you have to write it. Whether you publish or not, you talk over with your mentor. And you also, the honor students do a poster or oral presentation at a nursing conference. And you probably will be able to go. This class should be able to go. We've had the last 2 classes, graduating classes, had to do virtual, which is fine. But you can also go someplace to a nursing conference and present. We've had 6 or 7 publications where, as you see, the student, this is a student, is the first author. This is a student. So this was smartwatch. This one was childhood obesity. This was my student, and we looked at 2 feeding tools. She was first author. This one is about HIV. And then this Matham is also a student. He's doing a lot of work with immigrants from Burmese immigrants. So a lot of good students that we've had. This is someone presenting a poster. Well, again, it's not an honor society and it isn't easy. So you do have to write this paper, and it's a real research paper. That's what the thesis is. Your undergraduate nursing curriculum is tough, and this is on top of that. Now we're pretty flexible about deadlines. So if you have a paper coming up or an exam coming up, and you talk to us and say, hey, I have to postpone this next assignment until my other stuff is done, that's fine. But you do have to be engaged for 2 years and get your thesis paper done and get the poster done. This is not required for the bachelor's in nursing, and it's not lonely. So we have our little group of students, we take 5. And the students get very, very close. We've had some classes that maybe 3 or 4 years ago that are still friends. So you get supportive faculty and you get support of each other. You get individualized mentorship in your area. We like to match you up with mentors that have at least some interest in what you have. So we hope to match you up pretty well. We can't always do that, but we sure try very hard. So we have you come in and we talk about, what are your interests? What do you think you'd like to do? And then we try to find somebody that will be able to mentor you in that area. We have once a month seminars. So it's small group instruction in critical thinking skills. And we help you to get a research hypothesis or research questions that you want to find out about. And you have to write, so we help you to do scientific writing and speaking. And again, you get preferential admission to the PhD program. It's 6 credits beyond the traditional BS degree. So you're going to take your regular credits, and on top of that, there's 6 more. So in the first year, you take 2 1-hour seminar courses. You take 1 hour in the fall and 1 hour in the spring, and it's once a month. We try to work around your other schedule so that we, sometimes we have to meet at 6:30 in the morning on a Friday, but it's only once a month. And it's just nice. We have speakers come in, we talk about your work. And then in the senior year, you have another 1 hour seminar course in the fall and 1 hour seminar course in the spring. But you also get 1 credit each semester for your mentor, with your mentor. It's called an independent study. So it's just, essentially what this is you're getting credit for the extra work you're doing. Okay, and then the thesis is a scholarly paper and a poster or podium presentation. We have had such good students in the past couple of years that they have rated a podium presentation at a national nursing conference. So that means their work has been evaluated along with other faculty people, PhD students, and they've been chosen to do podiums. So that's really a feather in your cap if you can do that. But everybody does a poster at that conference. So anybody who is not a nurse yet, if you're in our College of Nursing program, you're eligible. You need to attend class on the Anschutz campus and not the South campus. We would like you to have a minimum of 3.7 GPA when you come in, but we take things into consideration. So like if somebody has been taking maybe a biochemistry, some kind of very, very difficult undergraduate, and they maybe got a 3.2, but those courses were very, very challenging, then we would certainly consider that student. And on the other hand, if somebody has like a 3.2 average and they say, well, I don't know, I wasn't that interested, then we might not want to take you into this program because this is pretty rough. And you have to be interested in research. So who benefits? It's, you can put it on your CV or your resume when you go look for a job. And a lot of hospitals now for magnet status, they would like people that know how to do a systematic project. And you get to work closely with distinguished faculty. You have these thought-provoking seminars and the independent study with your own mentor. So applications are due March 16th. Sometimes we extend that date. And then the interviews, we're hoping for around March 30th. After you get accepted, then we do interviews and then accepted to the nursing program. Then we'll do the interviews and we usually let you know just a couple weeks after we do those interviews. You can get the instructions forms through the admissions office or the CON website. And again, we interview people and we would like again to have that 3.7, but it's not absolute. You have to have a one-page resume, a CV. There's an honors program questionnaire that you fill out, 2 letters of reference, an essay, and this interview. So this is our website and the honors program information is on this website. So here, Nursing BS Honors Program. And this is the good news. We are paying for the honors courses in the spring of junior year and all the honors courses in senior year. Also, you have money to go to the conference. So we've had this particular conference that we kind of encourage you to go to is called the Western Institute of Nursing. And they have it sometimes at Disney, what is it in California? Disneyland, the one in California. Portland, we've gone to Portland, Spokane. So there's different places that it goes and we pay for your expenses to go. Okay. Now you have to pay for the first semester only because sometimes if you do drop out, then at least we haven't lost that. Once you get past that first semester, you're pretty much in. Okay. And these are people you can contact. You can contact me, you can contact Amy Sturrock with questions, Dr. Jankowski also. So now, do you have questions?
Hi, yeah, I had a question. I was reading on the website more information about the program, and it said that the letters of reference should come from your most recent academic advisor or research coordinator, something like that. And I'm coming into the program as a second degree student, and so I haven't been in college now for 10 years. Yeah. So I'm not sure what would be most relevant.
Well, I think somebody that you're working with, are you working?
I actually just wrapped up a job in public relations. So at the moment, no.
Well, if you had somebody there that could attest to what we're looking for is your ability to do this scholarly work.
Okay.
So, you don't want somebody that's going to say, oh, she's a very kind and loving person, which is good. I mean, that's good. But we're really interested in somebody that can say, yes, she's showing intelligence, curiosity, interest in research, something like that. So
Okay.
if you have people like that, we can use them.
Okay, great. Yeah, I was more so that the teachers that I've taken online for my prereqs aren't necessarily a close connection. So I just wanted to make sure that I could use someone else.
Yes, you could.
Okay, Dr. New, this is Daniel Morgan. I have a question about the data students use. Do they do primary data collection, or are they using secondary data sets or existing data sets?
Both.
Both, so yeah, it could be either way.
Yeah, you talk to your mentor and see, we've had people just develop their own questionnaire, and go out but it has to be connected to that mentor's area of research.
Okay, thank you.
Okay.
I have a question real quick as well.
Mm-hmm.
What are the current areas of research right now that are going on in your school?
Oh gosh. We have someone doing exercise work with seniors. We have, we had obesity work. We have some, oh gosh, I'm drawing a blank here, mental health. And that's pretty broad, that one. We have Dr. Paul Cook, who does HIV research and mental health, both.
Okay.
We have some, and if we can't find something that you're interested in, we go and look around. We've had a couple people go to the, it's a neonatal, they call it the farm, and it's neonatal research, but it's more of a bench research. And they've taken 2 of our students, and our students have done very well there. They also have, they all usually take graduate students, but they have taken our students, and it's worked out. So a variety of areas.
Okay, very cool.
That answer good enough?
Yes.
Okay. Oops. Okay. Anybody else?
Hi, doctor. I'm Allison. So I know that during nursing school, a lot of people can say your focus of interest changes a lot. And so I guess I'm wondering if you decide on the topic right in the beginning, or if that happens later on during the independent study courses.
No, because you only have 2 years. We don't want to keep you here forever because of the honors program. So in the early, we try to set you up with a mentor in September, October.
Okay.
And we really try, and that's a question we ask you during the interview. What happens if you do decide that you don't like this topic anymore? What do you do? Because it's hard to change this paper goes along. The literature review will take most of the first year. And then you do a little method. So if you switch, if you wait till the second year, you're going to be so far behind.
Got it.
And then we've had people change, at the end of usually by the middle of the first year.
Okay, but ideally right from the beginning, set it.
Yeah.
Okay.
This isn't your life's work, but it's an experience in research.
Thank you.
Hi, I have a couple questions. So the first one, I think you mentioned it, but how many people did you say were accepted into the program?
We're funded for 5. Now this year we have 6.
Okay, awesome.
We couldn't decide on the 5, so we took 6.
Okay, awesome. And then my second question was also about the letters of reference. So can that be from the same people that wrote the letters of reference for the application? Are they read by the same people? Should they be obviously specific to research, but I guess can it be the same people?
You can, but I think your focus is going to be a little bit different. I mean, if they would write another letter for this, like I say, when you're going to the nursing program, the focus might just be a little bit more clinical.
Right.
than what we're looking for. So they certainly can, and different people are going to read them.
Okay,
So
thank you.
Yeah.
Dr. New,
Uh-huh.
I had a question. So would something related to efficacy and diagnosis of mental illnesses, would that be something that would be within the purview of the program? Would that be an eligible possible?
It would. You know, and it might not be exactly what you want, but we do have some mental health people here, and Dr. Cook usually takes a person.
Okay.
He's very good.
Yeah, great. I just wanted to see, because I wasn't clear. It's not strictly biological or chemical related.
Oh no, and we have qualitative people, you know.
Okay.
If you know what that is, a qualitative study is more, you know, words and interviews. So we have,
okay, I see.
No, it doesn't have to be all biological, no.
Okay, thank you.
Anybody else?
Hi, Dr. New, I'm just curious if, well, like how long that preferential admission for the PhD program lasts? Like, is there a limit?
Of course, we would like you to go right away.
Right.
But we understand that after this grueling 2 years, some people want to make money and pay their debts, and maybe they're not quite ready to go on. So, you know, it's something that we haven't had happen.
Okay, so not like 5 years later kind of thing?
It might happen. That might happen. I think the fact that you were in this program for any PhD program, ours or anybody else's, you know, would be helpful.
Gotcha. Okay.
I have a question for you, Dr. New. How important is previous research experience?
Well, not.
Does it tip a scale one way or another?
No, it really doesn't. It's nice if you do, you know, but this is to help you learn research. So no, you don't have to have research experience, but you have to at least express an interest in doing research.
Okay, I was just curious. I did a thesis in my undergrad, and there you can make the argument that like other people need more experience. Like if I've already had experience writing a thesis, then maybe left preference for people who are new to the area and to further build their skills. So
no, it's just really very individual.
Typically, how many? Oh, go ahead. Okay. Typically, how many of like your 5 students end up doing the PhD program later? Is that kind of the majority, or does it depend?
No, it doesn't. It's not the majority. We're, like I say, I think a lot of it's been going on for, oh gosh, maybe 5 years, and there's 1 or 2 we know that have gone into PhD, and some have a fair amount have gone into master's programs. So we're hoping that at least, you know, later on people will come back and do a PhD. It's not mandatory that you that you say when you come in for the interview, I'm going to get my PhD, but you know, we would like it. But the fact is that we haven't had too many go on to the PhD so far.
Thank you.
Dr. New, my question was, I am particularly interested in immunotherapy, and I know it's kind of a broad topic and there's quite a bit of research going on already. Is that something that you can take on as an option, or is it something that there's so much research involved already that you need to pick a newer topic?
No, there's always a question.
Okay.
You know, yeah, you'd be surprised.
Dr. New, there is a question in the chat that I'll read to you.
Okay.
It's from Dominic, and he asks, is this program focused on observational studies, or could clinical trials be included?
A clinical trial, if you, you would be working with somebody who's doing a clinical trial and just take a piece of that. You wouldn't be conducting a clinical trial, because it would just take too long. And you're probably, I don't know, I mean, maybe you've had a lot of research experience, but you're probably not ready to quite do that. So mostly people who have done their own thing, mostly it's been just questionnaires that they've made, or gosh, what else? Maybe a tool that they've helped with, but a lot of people do their secondary data with their mentor, so use existing data. Or now the ones that have gone into the farm that I talked about, they have done some actual lab work. So if you're interested in that, then that might be something for you. Did that answer your question? Is he? Let me look at the chat.
He said yes.
Yes, okay.
Can you see that other additional question, Dr. New, as well?
What is the process for matching a person? Okay, that's a good question. We will, when we interview the people who we've decided to interview, we ask what your interest is so that we have an idea then, and that would be in the spring. And then, probably September, right after classes start, we'll have another meeting where maybe you've changed your mind a little bit, or and then we talk again about what you want to do, and then we really seriously think about matching up. So then we ask the person that we think you would be matched with well, and then you contact that person and talk to them, interview them, and see if you think that's going to work for you. And if it does, then you just go on from there, and that person will help you get your research question going. If it doesn't, then come back to, it would be Dr. Jankowski who does the junior work, and come back to her and say, you know, this doesn't feel right to me. And then we try again. Okay.
Are the PhD programs that you mentioned, are they, is that a funded program? Is it?
Well, you know, we're trying more and more to get some scholarship money.
Okay.
We're doing better every year. It's the nursing PhD program. It's the one that we have at the. So.
Okay. Thank you.
Mm-hmm.
So I think on that note, I'll go ahead and stop the recording, but feel free if anybody else has questions to go ahead and ask.